Natural disasters can affect anyone on Earth. No continent, no region is safe. In the last decade, an increasing number of such disasters has occurred and their severity has increased. The lives they have claimed and the material damage they have wreaked have become increasingly significant year after year. How can we face this? This is the question all the states, all the humanitarian organizations have been wondering. The 2004 tsunami has shown that we can barely limit disaster impacts even when we react quickly and when we have significant means of action. So what should we do? What means should we mobilize? How can we organize collectively? In short, how can we efficiently help the vulnerable populations?
A natural hazard is an event itself. Natural hazard is, for example, a volcanic eruption, an earthquake, a hurricane, a flood, the event that actually occurs. Vulnerability is defined as the susceptibility of a community, society, or geographical area to be affected and damaged by the natural hazard. For example, it is acknowledged that if a cyclone sweeps over a desert area, this won't create a disaster because the area is not considered to be a vulnerable place.
Vulnerability is the major issue. The French Red Cross has created regional intervention platforms in order to help populations the most exposed to risks.
To be able to face the emergencies, the French Red Cross has set up 3 regional intervention platforms. The first one is called PIROI and covers the South Pacific area. The second, called PIRAC, targets the Caribbean and America. And the third one is PIROI and covers the Indian Ocean. Actually, the concept of intervention platform is interesting because it enables the cooperation of the National Red Cross and the Red Crescent societies and gives the Red Cross the opportunity to design the emergency operating system. Moreover, these societies take an active part in the system because they are incorporated into emergency response teams and are involved on the ground when a disaster strikes in their own countries. The entire system gives us the opportunity to be as close as possible to the victims of a disaster and to enable the provision of a high-quality service. Above all, national societies are the ones who best understand their populations.
These regional intervention platforms have been deliberately located close to the populations regularly affected by disasters, so that emergency teams can intervene quickly. It has been now widely acknowledged that it is in the first hours following a disaster that many lives can be saved. In addition, rescue teams know the field well. They speak the language, were born among the local people. That is why they are more efficient. The regional intervention platforms are able to respond to any kind of emergency. The intervention platform for Indian Ocean, PIROI, usually operates in very difficult conditions. They have to intervene in numerous islands which are distant from each other, urban and coastal populations, a complex cultural melting pot, very uneven development levels, and most of all, a great number of disasters.
Millions of people have been affected by disasters in the southwest of the Indian Ocean. Floods, epidemics, cyclones. The PIROI is there to respond quickly and to reduce the population's vulnerability in emergency situations. The PIROI is made up of 7 National Red Cross and Red Crescent societies: the Comoros Red Crescent, the French Red Cross for Reunion and Mayotte, the Red Cross of Seychelles, the Mauritius Red Cross, the Malagasy Red Cross, and also 2 new national societies, the Tanzanian Red Cross and the Mozambican Red Cross. All these national societies make up today's regional plan called PIROI. The PIROI began in 1999 as a small-scale project. What we were hoping for was a disaster response base, a tool which would enable us to work with the populations using appropriate equipment and personnel when serious disasters occur. Today, this program has moved on and spread to a very different scale, since it also works before the disaster on reducing the vulnerability and, above all, on strengthening capacities of national societies. Each national society has now become a major player in the Southwest Indian Ocean area and is today a piece of the puzzle in the plan for regional intervention and disaster response.
The PIROI combines know-how, knowledge and equipment. When a disaster happens, it facilitates the action of national societies and supports them based on a principle of mutual regional aid.
I'll tell you this straight. Without the PIROI, we would be powerless. We would be like warriors without their weapons. We can easily manage a small-scale disaster, but when it comes to a national disaster, I cannot imagine the Comoros Red Crescent being able to face it. The Comoros Red Crescent feels reassured to have this partnership with PIROI, because we know that if we knock on the door of PIROI at any time, they will be there to help us and support us. They always support us. Thanks to our joining within PIROI, we now have a significant response capacity, and it enables islands to face disasters that may happen in this area with more confidence. This consists in having at our disposal pre-positioned equipment ready to be used in time. This system is a great advantage because whether in Madagascar, Comoros, Seychelles or Mauritius, if a disaster ever happens, at least we have rescue equipment in store. And this could enable us to respond to disasters more efficiently.
The situation was very different 10 years ago, especially in Madagascar, affected every year by cyclones. Today, Indian Ocean national societies have effective means of action at their disposal, strengthening state capacities.
PIROI is a very useful partner to me as an office director. PIROI brings us some comfort, knowing that we have here, in the sub-region of Mayotte, thanks to PIROI, rescue equipment in stock. This enables us to be operational quickly.
Indeed, if a national society is overwhelmed by the scale of a disaster, the other regional societies will come and support its action. In the early aftermath of the tsunami, the French Red Cross dispatched its rescue equipment stock, 500 tons in total, worth several million euros. The idea is that it is in the first hours following a disaster that many lives can be saved. That is why specialized equipment and skilled rescue teams have to be available near the areas prone to hazards.
PIROI network relies on 15,000 active volunteers in Southwest Indian Ocean. 15,000 volunteers who work for the national societies on other programs and who know perfectly their field of action, and also remote villages in their country. The communities there are used to seeing the Red Cross, so it is much more relevant to operate with populations who know us very well.
Many professionals are called upon: first aid workers, engineers, technicians, coordinators. But above all, besides the volunteer teams, there is a regional team set up with specific aim of reinforcing the regional Red Cross on the field. It is called RDRT, for Regional Disasters Response Team. This team is made up of skilled volunteers from each country. They undergo high-level training codified by the International Federation of the Red Cross and Red Crescent societies. They are very skilled in specific fields such as water supply, sanitation, vital goods distribution, telecommunications or health care. This team can be set to work in record time. Other such teams also exist all around the world.
Before this training, probably I could think, oh, Madagascar, where is Madagascar? Who live there? Who live in Mayotte and who live in Comorian? But now it's different. The communication was possible. After this training, it will be very easy for me to go and help people from Comorians, help people from Madagascar, help people from Mayotte.
To us people from Mauritius, working in Madagascar means understanding the customs and the taboos of the community. So the training has enabled us to share knowledge and skills learnt with trainers, and also to learn more about cultural behaviors.
Before I come, I was thinking, oh, who I will find there? And it's not a people that is a strange people. Now it's not a strange people, and we work as a team very well.
This enables us also to increase our national society capacities. Now I'm trained, I'm sure I can respond faster to the needs of the Mauritian community. And I can also disseminate the information to other Red Cross volunteers through new training.
A regional organization doesn't necessarily imply a withdrawal. On the contrary, each Indian Ocean National Society can be supported by Red Cross organizations from other areas. Let's say, for instance, that the Canadian Red Cross intervenes. It does it by bringing skills and funds. Cooperation and mutual aid are core principles of the international movements of the Red Cross and the Red Crescent.
What is behind this idea is to be able to strengthen the means of action of national teams thanks to training sessions, funds, or various aid actions in order to enable them to be more efficient in supporting their communities and their vulnerable populations.
Dealing with a population's vulnerability mitigation implies also focusing on prevention, because it's better to prevent than to cure. Both the Canadian Red Cross and PIROI work with that objective in view. What should we do just before a disaster happens?
Who is the most efficient? Who is the best prepared? Who is the first mobilized on the field? Is it the communities themselves or the NGOs? As efficient as the NGOs, PIROI and the Canadian Red Cross are, they will always arrive after the crisis. So the more trained, aware and prepared communities are to face different disaster scenarios, the more efficient they will be to save lives if a disaster was to strike. Promoting awareness in communities is a core issue of the Red Cross movement. Support communities to prepare thanks to a volunteer network from national societies. This really is the core issue of the Red Cross and the Red Crescent movement. Anticipating, preventing and reducing risks. The French Red Cross and PIROI, who have worked for 8 years on the preparation and response to disasters, were asked by many national societies to work together with populations. For instance, in the Comoros, the volcano is a major risk for the surrounding communities. These communities have very little or no awareness at all of the risks that exist. If they are able to comprehend the risks, they will be more likely to protect themselves. The population of the Grand Comore is not well prepared and is not informed about volcanic events. This is understandable due to the time period when you wait for 10 or 15 years without witnessing any eruption. In 10 or 15 years, you sometimes forget about the volcano. So now, the Red Cross has come here with a project to raise awareness of the population all over the island. I think their action has been appreciated by the communities and has been very efficient as well. People build their house on lava because they don't have any other choice. We are in our village because we can't go to another village. We don't have the choice. We know what to do to protect ourselves, and people know very well how to protect themselves against the volcano, thanks to the Kartala projects set up by the Red Crescent. Yes, raising awareness is a key issue because a population which is not aware of the risks is a disaster. It is a kind of new disaster. We can do everything, have all the technicians ready, all the Red Crescent and PIROI technicians, but if the population itself isn't aware of the risks, it is useless. We can't wait for the last minute when there is a volcanic eruption to tell people, okay, you are not going to this or this place, you have to calm down. This is what you have to do, you must not panic. So yes, raising awareness is extremely important when it comes to such disasters.
PIROI coordinates awareness-raising projects, in particular in Tanzania, a country that was affected by the 2004 tsunami. The French and Tanzanian Red Cross organizations have created several teams of volunteers. They have invented educational tools to promote awareness in the fishing villages.
The idea behind the project was to build a pedagogic tool by the community, for the community. So one of the tools we use in natural disaster prevention projects is called a risk and resource map. The risk and resource map is designed by the community through a participative approach, because the idea is that the community itself identifies vulnerable elements and resources that exist in their village. Based on that map, the volunteer will be able to raise awareness in his village and schools of tsunami risks and other risks identified by the community, such as floods or bushfires. Then he can explain to the other people where they can evacuate and which evacuation routes they can take. In terms of behavioral changes, it is very important to promote awareness of natural disasters among children as early as possible, so that even in their early childhood, they can have the relevant reactions if a tsunami were to happen tomorrow. If there is an emergency tomorrow, children and teachers can now help each other and give first aid. The Red Cross has promoted awareness of first aid in schools and has taught people about tsunami risks, and this has helped strengthen the community's capacities to give first aid and to respond to a disaster. Before they didn't know, now they know. I think it's effectively strengthened social cohesion in villages, and above all, people realized that they were able to face problems and to respond by themselves in their community and for their community, with people who have been trained and who have decided to take responsibility.
What we have learned in the community is security. If there is a risk, you must run to safer places. If there is a tsunami risk, and that you are in the water, you must stay in the water and swim to deep water. If you are in the village, you run to safe places like the school, the healthcare center, or you climb on a coconut tree if you have no time. Or you climb on the roof of a house and stay there. This is what I've learned with the Red Cross. We, in the Malagasy Red Cross, think that if the community was better prepared, it would save us a number of emergency operations. And we keep this idea when we're dealing with our partners. This is the paradox of humanitarian action. We benefit from lots of funds, lots of money to help us face emergencies. But when it comes to training a community, it becomes much more difficult. I have a particular sentence I like, but I hesitate to utter. It is the cynicism of humanitarian action. I think it is always a strategic decision, if not a political decision for the various donors, because it is always based on marketing strategy that implies visibility. I think they are more visible when acting in emergency situations after a disaster than in long-term training that might not be visible at all.
Preventive actions are certainly not very spectacular. They are not in the media headlines. Yet, groundwork before a disaster considerably reduces the number of victims. Prevention is neglected by too many organizations, but not by all of them. The European Union, as well as the French Agency for Development, provide funding through PIROI for preventive actions to face disasters.
Promoting awareness on topics handled by PIROI, that is, National Disaster Response, is an obvious objective. It must be done. Lives are at stake there, lives we can save.
PIROI has paved the way. Combining resources and knowledge has turned out to be very efficient. In the last 8 years, PIROI has carried out 22 actions to help nearly 850,000 people. As we are aware by now, the entire process around a disaster has been considered. It is, of course, about responding to the disaster itself. But it's above all about reducing populations' vulnerability. This is the key to a whole new humanitarian strategy. We must help populations to become active players in their own lives, whatever the hazards.
Mwana ewa Afrika tundanrowe dunia, dunia ya teknolojia, fikira na mfuwe tena chilewe noe, daraka ijojwa urishimia, daraka ijojwa urishimia, daraka njema unundo muhimu. Huzuni za